than that. We will always be doing everything we can to support all the various experiences and journeys as we work together. So thank you both again. Next, thank you. Next, we're very happy to be able to have Dr. Catherine Morgan join us. She will be discussing the transition from youth to adulthood. We never forget about the pediatric patients, and of course the impacts to the family. Dr. Morgan is currently appointed as Associate Professor in the Department of Pediatrics in the Faculty of Medicine and Dentistry, and she is a pediatric nephrologist and is researching how to protect young cardiac patients from suffering kidney damage during heart surgery. And so please welcome Dr. Morgan. Thank you.
Hello, everybody. Thanks for the opportunity to speak as part of this forum this evening. I don't know if, am I changing my own slides or how's this working?
We can change them for you. What to say next. Thank you.
Okay, so we'll just, next slide. So today, this evening, I'm just going to spend 20 minutes or so just really discussing another kind of journey that people make with kidney disease, and that's the transition from being a child with kidney disease to an adult with kidney disease. Next slide, please. So really, the objectives of this time that I'm going to spend with you, I hope to provide a bit of an introduction to the topic of transition to adult care, and introduce the unique health and psychosocial needs of youth with chronic kidney disease. Have a conversation about perceptions, barriers, challenges, and really try to think about what everyone's role is in this process, and then introduce some transition tools and resources. So next slide, please. So it's fairly obvious that children become adults, but it's also really important for us to remember that children with CKD must kind of move from this pediatric world into the adult world, also with their disease. So they're negotiating quite a few changes in their lives through this period, which is complicated by having a chronic disease. And so the question becomes, is this really so different than the transition other people have to make during this time? And as we discuss things through this time, hopefully we come to understand that it is. And then the other important thing to think about is, why do we care about this period of time in particular? So what do we know about the struggles and the difficulties? Next slide, please. So we do know from studies that have been done that the process of care transfer from pediatrics to adults is often associated with deterioration in the health of youth. And this is obviously for multiple different chronic diseases, but it's also seen quite obviously in chronic kidney disease. So if you look, there was a study, if we look at kidney transplant children and youth, so BC children's looked at their data, and within 2 years of transfer, these people have worse health outcomes than they would otherwise have. And this includes about a 24% kind of risk of graft loss or death. So this is fairly significant. So it's a bit of a worrying time in people's lives in terms of their health. And we also know that transitioning to adult care is associated with gaps in care and decreased clinic attendance. And so this makes kidney disease management much more challenging and increases the risk that young adults don't receive care until complications arise. Next slide, please. So we use the word transition. So what does this really mean? This is a fairly, it's been defined fairly well, and this is the current definition that's used for this term. So it's a process that involves purposeful, planned efforts to prepare the child patient to move from caregiver directed to self-management within the adult unit of care. And this is different from transfer, which is really the actual event that takes place at the end of this transition process. And ideally, a transfer happens at the completion of transition. But in the real world, this is rarely the case. Usually the transfer of care usually happens, fairly early in the transition process. So there's lots of risk of this transition not happening smoothly. Next slide, please. So we think we need to think about transitional care as a bit of a bridge over this gap between the pediatric and the adult world. And it's important to understand that some people kind of get over this gap with no problem. They just walk on over and things are pretty smooth. But for some people, it can be very complex. It can be a very complex time for them. So it's important that we understand about the things that make up this gap, and then also how we can help people kind of get over it. So if we think about the definition of youth as defined by the WHO, really this is the time in someone's life between the age of 14 to 24 years. And this is in terms of brain development and maturation. And this perhaps goes against what many people think of, if you turn 18, you're an adult and you're good to go. But the early 20s, the brain is still developmentally not the adult brain. And this is important information as we're helping in the care of youth with chronic kidney disease. So we know that this time is a period of increased risk-taking and impulsivity, and also non-adherence is fairly common during this time period of life. And like I said earlier, transfers often at 17 or 18 because that's sort of what our hospital or health policies dictate, but they don't yet have an adult brain developmentally. Next slide, please. So there's been a lot of people kind of looking at and thinking about and researching transition. And really, there's a few central themes that come out of all of this. And so the three themes are just around resources and multidimensional support, continuity of care and trust, and then parental involvement. And I like this picture because in my mind, I feel like that's what the adult world thinks of us in pediatrics, that it's just like a circus and there's some things to ride on and balloons. And so it's a bit of a different world in many ways. Next slide, please. So the first thing to talk about is the resources and multidimensional support. So in pediatrics, there's always a focus on growth and development through the lifetime. And this is in all children without chronic disease. And so when you add a chronic disease such as kidney disease into this environment, it really necessitates a large team. So not only do you need a physician and a nurse, but a dietitian, social work, psychiatry, psychology, teachers are often involved, play therapists, and then also the resources related to the family unit. So the support from a diverse multi-professional team is really a major difference in many places between pediatric and adult care. And then the other important thing to remember is that health and function of the family is very critical in the management of a child with chronic kidney disease, because their health outcomes are very dependent on the functioning and the health of their family. So there's a lot of resources that go into not just the child patient, but also into the health of the family. So we're moving from a family-centered support and resource model to more a patient-centered model in the adult world. Next slide. So I did a little survey a while ago just of some adults. This was nephrologists about just to get a bit of adult medicine perspective. And so these were some of the responses. So there's a lack of adequate resources in adults to replace those patients are used to in peds. We often do not realize how much less patients are getting insofar as guidance and support. They're used to frequent care visits with lengthy appointments and frequent contact with the team in between appointments. And this is difficult to provide in the adult world. Next slide. So the second theme when we talk about transition is really that of building trust in this continuity of care. And a recurring point raised by young people who have been transferred into the adult world is that there's a feeling of lack of continuity of care and that they haven't been able to build up trust that they experienced in the pediatric unit. Next slide, please. And this is just pictures of a young guy, just to give everybody, really, I find pictures are quite useful for this, but we've known him since the day he was born, and he's moving into kind of the transition period in his life. And so these families really experience a lot of things with their pediatric team. So there's a lot of time and a lot of communication and continuity. So this is established in the pediatric world for them, and then we need to move them out into the adult world. So that trust is very critical. Next slide. The piece of the puzzle, obviously, in terms of building trust with new youth patients, is often there's also a lot of time needed. And in adult practice in the adult world, this is often limited. Their adult patient loads are significantly higher. And so it's very limiting in that way. So even though we'll talk about a few of the tools at the end, but these tools may allow us to help youth, come prepared with their adult appointment with questions. They might be able to express their concerns properly, discuss plans, remember instructions. So these are all the things we want them to be able to do, but this only will lead to an efficient visit and a therapeutic relationship if they're able to build this trust with their care team. And again, it does take time. So we talk about trust in terms of the child and the family. And I think people think about that often, but there's also the pediatric team and the pediatrician and the pediatric nephrologist. And so if you can imagine there are significant relationships that develop if you spend an entire pediatric life with them. So, and these pediatric teams have to break these bonds also with the patient and the family. And so there's sometimes some worry that the adolescent and even the adult team is not ready. And so there may be this attitude of mistrust. So even if it's not explicitly stated, sometimes it underlies things that I think people have to be quite aware of, because it can often create a barrier for a new adult provider. So the third theme is really parental and family involvement. Parents are key players in the care of children with chronic kidney disease. I mean, I think that's fairly obvious for most people. And it's important that they need to be part of the transition process as well. So some identified barriers and struggles related to this theme are that parents are sometimes reluctant to set limits or push their children to do age-appropriate tasks when they have chronic illness. There may be insufficient family involvement once they've become kind of adults in quotation marks. There may be lack of resources to meet all of the psychosocial needs of the family. And pressures limiting time, which I mentioned. And then sometimes families have quite high expectations of what's going to happen kind of on the other side of this gap. And again, some adult medicine perspectives of this. Parents transition into a lesser role in the adult medicine world. And this is not paid much attention to, which can be a major stumbling block. When the parent is no longer driving the care, patients can start missing appointments, lab work, et cetera. And this is something that's very commonly seen. And again, just some pictures. This is the same kiddo, but it just really illustrates parental involvement in the care of these young people. So they're doing dialysis at home, often from birth until they're transplanted, and then managing all the medication. So they're very highly involved in the care of these people. And so when they move into the adult world, that can be, quite a loss for them and a struggle. So next slide, please. So we've talked about some of the barriers in transition, and then there's a few key areas in terms of what are some of the solutions for these things. So relationship building is really important. I think that's important in many things we do, but transition is one of the areas we know that's key. And these relationships need to be transparent, authentic. Sometimes humor can be useful. And then engaging the parents and having sort of empathy in this transition process is very important. For youth, periods of supported risk are needed to help them learn. So we can't let them just do everything all on their own just because they're 18, but they need increasing levels of autonomy, and they also need some opportunities for successes on their own, and also experiencing some natural consequences. So this is a bit of a hard balance, especially in kind of high risk things like transplant, but these are the things that we need to aim to do for them. And then really thinking about strengths-based approaches with people, because, not one size doesn't fit all for sure, and people have different strengths in this process. And then having flexibility. So technology can really increase access and engagement with youth. And there's a lot of web resources. There's a lot of different web resources for use of transition and chronic disease, and also some apps. Next slide. And just to note, the importance of transition is being increasingly recognized. So there's a number of policy statements, IPNA and the ISN, so two big kidney organizations have published some policy statements, and really they highlight that the goal is to maximize lifelong function and potential, and to provide developmentally appropriate services. And the key is that they're uninterrupted. But it's also important to remember that a lot of this is really consensus viewpoints. There is some research looking at the impact of these things in terms of outcomes, but that's fairly new and is just being generated. And there's also a Canadian national guideline on transition that's actually a very good resource. It's not disease specific, but it's obviously relevant for kidney disease, and it's put together by the Canadian Association of Pediatric Health Centers. So this is, and it 19 recommendations that can enhance and guide care of youth with chronic disease. So I just have a few final slides just to introduce some transition tools and resources, just mostly so people know they're out there. So Alberta Health Services actually has a number of tools on the web. I put the web page up there, but it's pretty easy to search. So they have it's called Well on Your Way for helping youth transition to adult healthcare. So next slide, please. So for youth on there, these are basically the topics that they cover. So you can see that there's quite a lot of things for learning and also keeping track. So under managing your health, they do kind of have some tools for preparing for medical appointments, how to talk to healthcare providers, a variety of different things. And then they also include some other things just about becoming an adult in general. And next slide. For parents and caregivers, they also have some resources. So a variety of things to look at. So planning early, some networking, and then really starting to understand the differences between pediatric and adult care. And next slide. And then for health professionals, they have a number of different toolkits. So I think it's really, when people move into the adult world, they transition to patients sometimes make a fairly small proportion of an adult practice. And so that adult care team may not have a lot of experience with, pediatric development, youth and those sorts of things. So there are a lot of good resources out there for gaining that fairly quickly. And some of them can be found on this website. And then next slide. And then this is just an example. You don't need to look at all the details of it, but this is one of the toolkit tools on the website for healthcare providers, just as an example of what they have. So it basically gives you, a breakdown of basically a checklist of what to discuss, what to do, who and where you can get support for doing these things at a variety of different ages. And so it just helps people really focus on making it a priority in health encounters and talking to youth about transition as well as their families. And then next slide, I think that's the end. Yep. So hopefully we've achieved some of those objectives, and then we have some time